Hello again. My name is Dr. Jerry Oneal. The program is A Few Moments of Medicine being brought to you by Dallas Live Tonight. The subject today will be sexually transmitted diseases. Some adult discretion may be advised. Sexually transmitted diseases have been a problem for hundreds of years, and it remains a problem today. There are essentially a number of sexually transmitted diseases, some more common than others. Some are easily treated, some not so. But we'll start with the first one, and possibly one of the oldest, that is syphilis. Syphilis was originally described by the term Lues, L-U-E-S. This is an antiquated term, but it's still occasionally used in literature. Syphilis is transmitted by the usual method, that is sexual intercourse. It may be transmitted from people who don't even know they have it. In fact, the earliest sign, once you've contracted the disease, is usually a sore or an ulcer on the genitals, which we call a chancre. That's C-H-A-N-C-R-E. That's primary syphilis. At that point, the disease is transmissible and remains so as long as the person has the disease. After the chancre heals, the person may not know that they have any disease. Syphilis can go into a latent phase where the person feels perfectly fine. This can go on for years. The only way to tell if someone has it is through the history, suggestive of it, or a blood test, which is usually referred to as a VDRL, or Venereal Disease Research Laboratory test. There are other tests that are more complicated, and further down the road, people may even require neurologic testing, including a spinal tap. When the disease comes out of its dormant stages, that is its latency, and goes into its long-term stages, it can cause neurologic problems. It can also be transmitted from mother to an in utero fetus. That is, children can be born with congenital syphilis. The treatment for syphilis is fairly straightforward. Once it's diagnosed, the treatment is and remains penicillin. The amount and the timing of the doses depends on which stage you're judged to be in at the time. It's also important to note that, number one, people who contract syphilis frequently contract another venereal disease, or perhaps even two along with it. So multiple tests should be done anytime someone is tested for syphilis. Number two, being treated and essentially cured does not mean you're immune and you can't get it again. You absolutely can, and people have done that. But it's a disease that's more common than most folks think. Along with syphilis, people often get what's known as gonorrhea, caused by the bacteria Neisseria gonorrhea. It's also known on the street as the clap. Now, it has a few more symptoms. Women usually have a purulent or foul vaginal discharge, although they may not. Men frequently have a urethritis, that is an inflammation of the tube inside the penis, and they have a spontaneous discharge. In point of fact, the only disease that causes a spontaneous urethral discharge, that is, it comes out on its own, you don't have to be urinating or whatever to see it, is gonorrhea. In fact, men frequently come to an emergency room complaining that they have a discharge that's staining their underwear. In that event, one can almost bet that they have gonorrhea. Gonorrhea itself was also treated well with was treated well with penicillin for a long time. During the Vietnam War, strains of gonorrhea were imported into the United States that have varying bacterial resistance. Penicillin is no longer the first line choice of treatment. That would be a drug called ceftriaxone, which is a single injection, although the wise physician is the one who sends off a culture to make sure that the strain of gonorrhea his patient has is susceptible to those antibiotics. If not, then other antibiotics are indicated. The third relatively common sexually transmitted disease is chlamydia. Chlamydia can cause trouble in women. It causes a vaginal discharge. Men frequently don't even know they have it. In women, it can not only cause a vaginal discharge, it can lead to infections that can be serious, including pelvic inflammatory disease, which often is severe enough to at least have surgery as a consideration, but certainly it usually requires hospitalization and intravenous antibiotics for proper treatment. Tubal pregnancy can also be a complication of chlamydia. Chlamydia can be treated in its lesser forms with oral antibiotics and completely eradicated. However, very much like the other diseases, having been treated and having been cured does not prevent you from acquiring the disease again. So that's important and worth repeating. Syphilis, gonorrhea, and chlamydia all can be treated, all can be cured, but none guarantee that you can't get it again. You can get it again in each case. The third common sexually transmitted disease is actually an insect. It's called crab lice. These are lice that infect primarily the pubic hair. They're similar to body lice, except they prefer pubic hair and occasionally in the axilla or the underarm. There's rumor to the effect that if one shaves one's genital areas, that they can't get crab lice. This is absolutely not true. As we all know, shaved hair grows back rather quickly, and it takes only a very small shaft of hair for the lice to lay their eggs. The eggs hatch 2 weeks later, which brings me to brings me to the primary way that crab lice are treated. It can be treated with over-the-counter, that is without prescription, medications, which consist of shampoos or creams that essentially are insecticides. Your pharmacist knows about these, and if you consult the pharmacist and say you believe that you have some form of lice, the pharmacist can point you in the right direction. You need to be treated according to the label on the medication, and then treated about 10 days to 2 weeks later to make sure that any eggs that were laid prior to treatment, if they hatch, that the organisms are killed. But again, just like the previous discussion, crab lice, once eradicated, doesn't mean you can't get them again. You can do it. You can do it as often as you're exposed. Okay. The third the next sexually transmitted disease is trichomoniasis. Now, trichomonas is actually not a bacteria or a virus or an insect. It's a protozoan, much like the amoebas you learned about in high school or college biology. It's a single-cell organism. It infects both men and women, and usually doesn't cause a great deal of trouble, although it can cause a chronic vaginal discharge in women and occasionally can cause more serious problems. It too can be treated with the appropriate medication, and it too can be contracted a second time. Finally, we come to the viral diseases. This is actually a group of 3 diseases. The first is herpes type 2. Herpes simplex is a common virus, and it has multiple types. Herpes type 1 causes cold sores. Most people have had a cold sore, or at least most people know people who've had a cold sore. This can be treated easily with antiviral creams, lotions, and even some people who have cold sores very often can take oral medication to suppress the outbreaks. The outbreaks can never be cured. The same is true of herpes type 2. Herpes type 2 is genital herpes. It is transmitted in the usual way, that is sexual contact with the other individual, and it does cause sores. that are recurrent, either on the penis or inside the vagina or on the vaginal lips, if you will. These sores usually last approximately 7 to 10 days and are usually vesicular in nature. That means they have a small bubble, so much like a blister on top. They can be relatively painful. On the other hand, they go away by themselves in about 7 to 10 days. The disease can be treated if people have frequent outbreaks. There are several antiviral drugs that will suppress the outbreaks, and it is true that the longer someone has the disease, usually the outbreaks become fewer and fewer as time goes on, but one is never completely rid of the virus and can always transmit it, even if they don't have an outbreak. The next disease is hepatitis C. There are multiple types of hepatitis. Most people in this country refer to hepatitis C as a form of blood-borne hepatitis. In that respect, it's similar to hepatitis B, which was a very large medical problem for many years, but is becoming less frequent because now children, shortly after birth, are being vaccinated against hepatitis B. Hepatitis C, on the other hand, is also blood-borne and can be transmitted by sexual contact or blood transfusion or any way that bodily fluids can be exchanged, with the exception of kissing. Usually hepatitis C cannot be transmitted by the exchange of saliva. It usually has to be some other bodily fluids, either blood, semen, or vaginal secretions. Hepatitis C can lay dormant for years. Unfortunately, if untreated, in at least a fair percentage of cases, can lead to end-stage liver disease, liver failure, and death. That usually is about 20 to 30 years down the road. But nonetheless, the person will still test positive for hepatitis C on the appropriate blood test. Fortunately, within the last 3 or 4 years, science has developed treatments for hepatitis C that apparently are completely effective in eradicating the disease. The downside of the treatment is that they take at least 6 months. The first one out took a year, but you had to take it daily for 6 months, now for 6 months, previously for a year, and it was quite expensive. The first treatment on the market was about $100,000 for the year. Drug companies, however, are willing to give patients who can't afford the medication a break on the price. Usually your doctor will have the forms and know the contact information to ask the drug company to help you with the cost of the drugs. But hepatitis C can be cured. It can also be reobtained. That is, you can catch it again if you do the same thing with an infected partner or if you share needles with an infected partner. The final viral disease is HIV/AIDS. HIV/AIDS became apparent in this country in the early 1980s, and at that time was essentially a death sentence. HIV is a virus that attacks the person's immune system and makes you susceptible for illnesses ordinarily which most people wouldn't have any problem with, would kill you. And in fact, most people with AIDS die of what is known as opportunistic infections, and that is the bug has the opportunity to cause the infection, whereas in a person with a normal immune system, it wouldn't be a problem or they would shake it right off. There is no cure for AIDS yet. There are very good medications that will control the symptoms, that will allow people to live a pretty much normal life, but they'll have to pay attention to this disease for the rest of their lives. Can they still transmit the disease? In some cases, and depending on certain blood counts, the answer is yes. In some cases, the transmission rate would be very unlikely. This is a disease that has to be managed continuously by medical personnel, or person will develop serious complications and ultimately death if not treated. So, to summarize, we have several infectious diseases that cause illness and are transmitted sexually. The first was syphilis, second was gonorrhea, then we spoke about chlamydia, crab lice, and trichomoniasis. The viral diseases are herpes type 2, hepatitis C, and HIV/AIDS. I hope this information's been helpful to you. I certainly hope you never have to use this information. But until next time, this is Dr. Jerry Oneal for Dallas Live Tonight saying thanks for watching. See you next time.